Okay, I'm going to demonstrate some iliacus pullbacks. This is something you would want to do as recovery or even daily, maybe before your workout. It is something that we can use to help with pelvic floor strengthening. And also, I find that most of my clients, the reason I'm doing it is really because of hip pain. So if the femur bone is sitting too far forward in the socket, when you go to squat, you might feel some impingement. So the iliacus pullbacks can really help get that femur to sit properly and hopefully reduce that discomfort that you're feeling when you squat. So we can do a couple of things, and it's not going to look very apparent on camera. So I'm going to kind of talk you through a couple of these ways here. Get my mat on the ground. So we're going to get into quadruped position, which is just on all fours. We're going to keep a neutral spine, neutral back. So we don't want to drop the hips to the ground into anterior tilt. We don't want to tuck the glutes aggressively so that we're posterior. So just kind of find a nice flat back. And then you're going to really focus on keeping that back nice and steady. We're going to lift each knee off of the ground, alternating. And try to avoid aggressively swaying and swinging to one side or the other. Okay, so what I want you to think about is your hips doing this. Okay, it's a small, tiny movement. So I'm going to come back down here. I'm going to lift this side first, closest to the camera, straight up, and then bring it back down. And then the other side up and down. And so we're just going to keep going through that tiny movement, thinking about really moving the femur bone up into the hip. We're trying to not drive side to side when we're doing this. So lift, bring it back down, lift, bring it back down. So don't lift and move away from that position. Keep a strong, stable, steady back. So then another way we can enhance this is lying on our back. This is kind of a slick surface for me, so I might want to put a towel on it or get something different like a chair, but we can still get it done here. Give yourself something to squeeze, right? So that's also going to impact the exercise a little bit bigger for you so that you feel those movements. So slight tilt up, and then you're just going to basically like you're rubbing whatever's between. So it's my yoga block, shifting those hips up, then drop, other side. So you're doing the same thing that I was doing on all fours, but now you're also incorporating an adductor squeeze, which is going to really engage those muscles and help release, hopefully, that impingement that you might be feeling or discomfort in the hips when you squat. And if you place your hands on your hip bones, you should be able to feel them lifting side to side as you're doing that. So small movement. I know that it's hard to see on video, but hopefully when I demoed what you should be feeling with my hands, it translates and you're able to perform these. So remember, this is something just like that you're doing daily, especially if you're experiencing that pain or pelvic floor therapy, strengthening. It's not like an exercise that's going to make you sweat, right? It's just to perform better. So keep that in mind. And yeah, that's your iliacus pullbacks.